Hi, everyone. My name is Annie Rogers, and on behalf of the ADDitude team, I'd like to welcome you to today's ADHD Expert presentation titled The Emotional Lives of Girls with ADHD. Leading today's presentation is Dr. Lotta Borg Skoglund. Dr. Skoglund is an author, keynote speaker, and entrepreneur from Sweden. Her specialty is in psychiatry, addiction, and family medicine with a specific focus on ADHD. She currently holds a position as associate professor at Uppsala University in the Department of Women's and Children's Health. She also leads the pioneering research group, Goddess ADHD, and is author of a wonderful new book called ADHD Girls to Women. In today's webinar, we're going to discuss emotional dysregulation. Big emotions can manifest as tantrums, meltdowns, even as self-harm in young girls with ADHD, or it can be hidden. Some girls may mask their symptoms and their feelings of anxiety and depression. They may also struggle socially, saying they just don't fit in. Young girls need caregivers who understand the special challenges they face, and that is why we are here. So to begin, we'd like to do a little bit of a level set by asking you a few short poll questions. We'd like to know, for those in our live audience, has your child been evaluated for ADHD? Please let us know the status of that. And then to follow up, if they have, but they were not diagnosed with ADHD, do you think that including emotional dysregulation in the diagnostic criteria would have changed your child's diagnosis? This is your opinion, whether you think it would. If your child was diagnosed with ADHD, we're curious whether they were screened for any comorbidities. So specifically, we mean co-occurring conditions like eating disorders, depression, anxiety, anything along those lines. So while you do that, I will point out that you can find answers to common webinar questions about slides, transcripts, and certificates of attendance by clicking on the FAQ tab of your webinar screen. And if you support the work we're doing here at ADDitude to strengthen the ADHD community, we encourage you to visit attitudemag.com/subscribe and sign up for our magazine for yourself, or to share with someone who could benefit from greater ADHD understanding. You can click on the magazine tab of your screen to learn more. And I would be remiss not to mention that ADDitude has an ebook titled Women with ADHD that offers some additional supplemental guidance on hormonal changes, ADHD subtypes, finding a doctor who will take your symptoms seriously. You'll learn why science has paid very little attention to female ADHD and how you can benefit from a diagnosis at any age. Okay, without any further ado, please welcome me in welcoming Dr. Lotta Borg Skoglund. Thank you so much, Dr. Skoglund, for joining us and leading this really important discussion today.
Thank you so much for the opportunity to talk about the emotional lives of girls and young women with ADHD. I'm a huge ADDitude fan, so it's a real honor for me to be presenting here today. And when I started writing this book, I looked forward to dive into the pool of knowledge about female ADHD. But I soon realized that you're not supposed to dive in such shallow waters. And that was really frustrating for me, since the end of the pool dealing with pre-pubertal boys with ADHD is so huge and deep, right? So this is what we're going to talk about today. But I would like you to first meet Annie. Annie is 19 years old, and she and her parents have some critical questions to us about the emotional lives of girls and young women. And I think we will have some answers for her after this webinar. First of all, Annie wonders if her ADHD brain is wired differently. And her parents wonder how emotional dysregulation, PMS, PMDD, RSD, hormones, and mood disorders are associated with ADHD. They also want to know what girls and women like Annie risk if we keep missing their specific challenges. And what Annie and her parents can do themselves to improve her physical, mental, and sexual health and quality of life. So really good questions. Hopefully we will be able to answer at least some of them. And let me see. But let's start by reviewing what problems we may face then if we continue to view ADHD from the male norm. The thing is that when presented with a case of a boy with ADHD, I can call him Andy, we as parents, teachers, healthcare professionals are quite fast to identify his problems as caused by ADHD and suggest evidence-based treatment for him. If we change nothing about this vignette, but the name Andy for Annie, however, we tend to think quite differently. So then we will focus much more on Annie's relationships, of why she is so desperately seeking attention. And have you seen the quite provocative content on her TikTok account? Maybe she's been traumatized somehow. Maybe she's been sexually abused. Well, instead of thinking about ADHD, we start looking for psychosocial causes to Annie's problems. And Annie will probably be offered to talk to someone about her problems, maybe a consultant in school or a family treatment by the social services. And if or rather when, in Annie's case, she doesn't get helped by that, she will probably be offered antidepressants, perhaps something for anxiety, perhaps something for sleep disorders, or even mood stabilizer for her emotional instability before we even consider ADHD in her case. So I'm exaggerating to make a point, of course, but looking at our research data, this is not as far from the truth as you would wish. In fact, in our most recent study, we found that boys got a head start of about 4 years in respect to diagnosis and treatment. Instead, females were typically missed during the formative years of childhood and adolescence. So we looked at them 5 years before and 5 years after they got their ADHD diagnosis, and females consistently had a higher risk for physical and psychiatric comorbidity and self-harm. They were more often prescribed sedatives, anxiolytics, antipsychotic drugs, or even opioids. And they showed up absolutely everywhere in the healthcare system and in our social services, often due to mood disorders or consequences of emotional dysregulation. Unfortunately, we are just still so used to look at ADHD from the perspective of the disruptive boys. But Annie, just as Andy, has ADHD. And this is how Annie would describe her ADHD life, because she feels that she is different, and there's always been something different about her, something that is just slightly off, but not enough for others to see and validate that. Rather, others try to normalize. Everyone feels like this. Everyone thinks this is difficult. Everyone struggles with this sometimes. And Annie just feels that there's something different, but she can't really find the words for it. And she also feels that her brain fails her, that she's stupid. And when she needs to concentrate, her thoughts just slips away or stops. And when she should relax, her mind starts working like crazy to solve world peace or what happens after you die and think about those kind of stuff. And she feels really hopeless because she can't control her emotions or her energy levels. And she's realized that if she is going to pass school or manage life, she will have to be so disciplined and so controlled. She'll have to control what she eats, when she exercises, when to study, how she is with friends. And age 19, there's just not that much spontaneity left in her life. Her perfectionistic tendencies are turning into a OCD orthorectic prison for her. And from the perspective of me as a clinician and a researcher, I know that just by fulfilling the criteria for these 4 letters, ADHD, you will live about 10 years shorter than a person of the same age, sex, and socioeconomic status. And many of these years are lost due to the comorbidity and in undetected and untreated ADHD. The good thing, though, the light in the tunnel, is that almost all of these years can be saved if we find and identify and properly treat women with ADHD in time. So, girls with ADHD. They do exist, and given how serious or misdiagnosed ADHD can be, the fact that girls with ADHD fly under our radar is a serious problem. And research shows that girls with ADHD show fewer externalizing symptoms and more often get the ADD diagnosis. However, these girls exist and they do struggle without being recognized. And they experience social and academic challenges, and they keep it together outside of home because girls on a group level at an earlier age than boys realize what's expected of them in social settings. So they mask and they compensate, but that drains them of energy. And the meltdowns and the tantrums that they get in the safe environment of home or in safe relationships actually hurt their relationships and their self-esteem very much. So as ADHD most often doesn't you most often doesn't grow out of your ADHD. These girls that fly under our radar will grow up and enter puberty, a period that is very intense biologically, socially, and existentially in both the changes going through the body and the social situations. And now we see these women and young women everywhere, because they struggle with their emotions. They show up in healthcare for depression, anxiety, eating disorders, injuries, or in social services because of trauma or victimization. And the paradox occurs that we miss them again. So because of, as in the case of Andy and Annie, we get the causality backwards, and we blame Annie's struggles on trauma or bullying or peer rejection or depression instead of considering that it might be her very ADHD that puts her at risk for depression, trauma, or social failure. So this is really important when we talk about what comes first and how we need a very differentiated view when we look at the problems of young women with ADHD. And before Annie came to me and before I met her, she was diagnosed and treated for at least 10 different conditions. This is a really messy picture, both for Annie and for me, right? And you can wonder if everyone before me just had missed the core of Annie's problem, her ADHD, or that we may have seen the same struggles or her problems the same way, but framed it differently. And laying the puzzle of Annie's diagnosis, ADHD, borderline, anxiety, bipolar, eating disorder, autism, among other diagnoses that she's had in her young life, we will find that in the overlap and the intersection of these diagnoses lies emotional dysregulation. So clearly, the emotional lives of girls with ADHD is a big deal, and emotional dysregulation is more the rule than the exception in ADHD. And our emotions are important for us as humans. We use them to communicate our needs to others. And struggling with recognizing and regulating your emotions is a huge handicap in life. And it's important to try, even though the picture, Annie's picture of her comorbidity is really messy, it is important to try to disentangle emotional dysregulation in ADHD from other distinct comorbid conditions, such as depression, anxiety, bipolar disorder, or borderline personality disorder, since they are more common in individuals with ADHD, and also they may need specific treatments outside of the ADHD treatment. And then we also have the downstream consequences of living with ADHD, such as the increased risk for peer rejection, the shame and the stigma associated with having a behavioral diagnosis that increase the risk, of course, to develop depression, social anxiety, and rejection sensitivity dysphoria, RSD. So obviously, there are quite different and complex mechanisms underlying this overlap between ADHD, mood disorders, and emotions. And a way of looking at the science behind this overlap of ADHD and emotional dysregulation that resonates very well with the testimonies that I hear in my clinical practice is developed by my friend and research colleague Predrag Petrovic. He and his colleague Xavier Castellano describe emotional dysregulation in ADHD and borderline personality disorder as difficulties in two similar but not entirely overlapping top-down brain regulating mechanisms. So in this model, ADHD is viewed as difficulties in regulating more cool or executive attention, while borderline and the difficulties associated with borderline represent difficulties in controlling more hot or emotional circuits in the brain. So in this way of looking at it, ADHD and borderline becomes like sister conditions of similar but not identical processes. And Petrovic and Castellanos, they argue that we may talk about an emotional subtype of ADHD located just in between ADHD and borderline personality disorder. And that might help us actually also target and tailor interventions and treatments directly to a specific individual. But we have to make the picture even messier, unfortunately, for us as girls and women, because we have to also factor in the fluctuating hormones across the entire reproductive female lifespan. So estrogen and progesterone will be produced in the ovaries, among other places in the body, and they easily pass through the blood-brain barrier and access our brains. And there are hormonal receptors in literally all brain regions that are involved in emotional regulation, indicating that hormones are very much involved in how we feel and how we function. So this is really important and again, not sufficiently taken into consideration. And the risk, again, that we miss when we use research and clinical experience based on pre-pubertal boys that do not have not entered puberty yet, and once they enter puberty will not exhibit these monthly fluctuations of quite dramatic changes of estrogen and progesterone levels. So firstly, we know that these predictable periods of changing hormonal levels create vulnerable periods across the entire female life, or the entire female reproductive life anyway. So in our research group, we have actually targeted these vulnerable periods in the women's and girls' lives, and done studies specifically in youth centers, in maternal health care, and in women's clinics. And these studies, they show that, for example, teenage pregnancies and teenage births are 6 times more common in girls and women with ADHD. And we know that giving birth to a child in a very early stage in your life will affect both your and your young child's psychosocial development across your entire life. So this is something that we wish that girls and women, young women with ADHD, also are allowed to plan when they are founding their families. And ADHD girls and women are actually 5 times more likely to experience depression following the traditional prescribed oral contraceptives. And we also have shown that 20% of pregnant women with ADHD will develop postpartum depression and anxiety following birth. And that women with ADHD more often suffer from pain and stress-related conditions during their perimenopausal year. So across the entire female lifespan, there are vulnerable periods associated with fluctuations in estrogen and progesterone levels. And again, I guess I will have to stress this a lot of times during this lecture, but 99% of the research is done on males or even prepubertal boys, where this is absolutely not taken into consideration. So, from puberty to menopause, naturally cycling females will experience quite dramatic fluctuations of circulating sex hormones, affecting both how we feel and how we function. Let's say we have like a cycle of 28 days, a normal and regular length of a menstrual cycle. Then day 1 to 14, or the follicular phase, will be about the body preparing to release or perhaps also receive a fertilized egg. This is why estrogen levels will rise to a maximum peak at day 14, triggering this ovulation. And research actually shows that risk-taking behaviors may increase, not necessarily due to negative feelings, but due to positive emotions during this time of the menstrual cycle. However, as often is the case in young females with ADHD, if the result of, even though positive impulsive behavior, is drinking alcohol, taking drugs, having risky sex, driving irresponsibly, or shopping impulsively, the consequences might be just as serious, right? And also, since estrogen and dopamine may potentiate each other, side effects of ADHD medication that affects dopamine levels may further increase the risk-taking behavior. So if you have an ADHD profile that is defined mostly by impulsivity and hyperactivity, this part of the menstrual cycle may actually be the most difficult part of the month for you. And then, following day 14, estrogen level falls quite steeply, stabilizing on a lower level during day 15 to 28, the luteal phase. Then instead, progesterone levels will start rising, creating an entirely different hormonal environment where women generally report more symptoms of depression, anxiety, rejection sensitivity dysphoria, sleeping problems, cognitive difficulties with the memories, etc. So if your ADHD profile is defined mostly by low energy levels and anxiety, then the period around a higher estrogen level might offer a welcome energy and mood boost, but you may instead suffer tremendously with PMDD, PMS in the later part of your luteal phase. And this just sheds light on how important it is to not just use the one-size-fits-all regime that we do when we use the male as the norm for ADHD. And in fact, females have shown to have an increased risk with everything from stress, depression, anxiety, to relapsing into binge eating, addiction, suicidal ideation, and psychosis in the luteal phase. And there is also, even though a very limited research at this point, indicating that women with ADHD are at increased risk for just experiencing PMDD, postpartum depression, and worse climacteric symptoms. But again, we talk about this and we hear this a lot in our clinical practice and in our everyday life, talking to each other. So we might think that there is a lot of research on these topics out there, but it's not. And the problem is that the research that is there showing that there are vulnerable phases in a woman's life for both ADHD and non-ADHD women, still almost no one, me included, in the clinic, asks us about hormones when we seek counseling for mental health issues. And this is, again, a huge lack and problem that we are facing as women, where we actually risk not getting the correct medical advice and support. So, in essence, female ADHD, emotions and hormones can create the perfect storm for girls and young women with ADHD. And unfortunately, there's almost no research validating girls and women's experiences here. So at this point, I'm afraid to say that it's really up to us as girls, women, parents, clinicians to try to figure out how this is all tied together for every single unique girl and woman. And it might sound like that is a huge job for me as a clinician, but it's not, because it's really interesting and it's really rewarding. So I really urge all of you, either if you are a clinician or if you are a girl or a woman yourself or a parent to a girl, to really lean in to this knowledge about how hormones affect our ADHD symptoms and our mental health. And this is also why our research group always use patient and public involvement and co-create both our research questions and the self-care tools that we develop, such as Letter Life that I'm going to show you soon. And to this end, we have developed a model that we call ADHD 24/7. And this is to capture like the wider perspective of the ADHD life for both children and adults. Because ADHD doesn't go to bed, it doesn't take lunch breaks or vacation. It goes on 24/7 and it affects every aspect of your life. And to get the correct support, you need to speak the same language and to be able to communicate both your difficulties, your problems, your strengths, and also your needs to your doctors or to your nurses or to the teachers in your child's school. So I will just quickly walk you through the 2, 4, and 7 of our model and try to explain why we think this is a good way to start when we build the common language and the common knowledge about girls and women with ADHD. So we start out with a holistic view of us humans, and we argue that we all, regardless of if we have ADHD or not, actually have some basic needs if we are supposed to live a good and healthy life. So first of all, we need a social community where we safely can communicate what we think, what we feel, and what we need without being judged. Many girls with ADHD that I talk to does not feel that school provide a protective or inclusive tribe for them. Quite the opposite, in fact, and unfortunately. And also, except having this social community, we also need a calling where we feel that what we do contributes to something that is meaningful for someone more than just me. And we also need to feel competent to handle the challenges that we face in life. And again, so many of the girls that I meet doesn't feel that there's very much meaning with anything in their lives at the moment. School being, unfortunately, again, no exception. And it's really hard to motivate yourself and to motivate yourself when you have ADHD, who is a motivational disorder at large, to motivate yourself then to go to school and to participate in this when you don't see the purpose of it all. And we think, and we have discussed it at length with our patient panels and our lead patient users, that if we ignore these two basic areas of life, our support and our interventions risk being at best useful and at worst actually harmful for people. So this is a very important basis for what we do. And then we have the 4 in our 24/7 model. And an important aspect then of building the emotional intelligence in ADHD is to understand how your ADHD brain is wired and how it deals with information from the outside world and from your body. So by talking about how all brains are different, have strengths and challenges, and by using metaphors for different complex brain processes such as central coherence, top-down regulation, metacognition, and cognitive flexibility, for example, we allow even younger kids to understand why some things, like, for example, emotional self-regulation, may be so much more difficult for me than for my peers. So the 4 most important areas of concern here then, and that stands out in our research, are your brain's control tower. So this is your ability to overview what you need to plan, prioritize, organize, execute in your everyday life. And imagine that your brain is like a huge airport with planes coming in from the entire world every minute, taking off every minute, and everything needs to be coordinated to the very second to avoid like crazy or disastrous accidents. And then imagine that you don't have anyone working in the control tower of your airport. You have to manage everything manually. And just an ordinary day in school will require enormous amounts of energy. So this is the first important area that we have to discuss with our girls. The next area will be to the brain's volume button. So your ability to regulate and moderate not only your activity levels, but everything from your energy levels, appetite, to your emotions. So imagine that your volume button gets stuck at 0. It's impossible to get anything done. And everyone around you just say, but just do it. You'll feel so much better afterwards. And then imagine how this volume button stuck at 0 without you knowing how or why just ramps up to 100. And it's impossible to stop eating. It's impossible to quit gaming or to wind down and go to sleep. So that was the second area that we need to discuss with our ADHD girls, and that we need to actually have a common language for. The third area here would be our brain's virus filter, or your ability to filter out irrelevant information from the outside world and from your own body. So then imagine that every microscopic stimuli comes through into your brain and requires process speed in your brain. In your brain's hard drive. It's everything from how the clothes feel on your body, your bowel movement, smells from outside. Everything competes for your attention. And that is something also that girls and women can describe quite vividly, how extremely tired they get in social situations. Not because they don't appreciate the social situations, because they cannot handle the influx of competing stimuli. And then the fourth area would be your brain's gearbox, or your ability to shift out of negative ruminating thoughts, or to try something new when the things that you do actually don't work anymore. So then imagine that you keep getting stuck in loops of negative, toxic thoughts. And even though you know that it would be really good to try to view things in a lighter perspective, and that these clouds really, or thoughts really cloud your mind and poison your relationships, you just can't think past them or stop their toxic influence on your mental state. And that is also something that is common for female with ADHD to describe, and that we have to have a common language for. And then moving to the next last part of the ADHD 24/7 model, then, is our 7 lifestyle factors that cause so much of the risk for both mental and psychiatric comorbidity in ADHD, but also that carries great possibility of improving our emotional intelligence and build emotional resilience if we can find healthy routines and we can do them with moderation. But it's no secret, and research clearly shows that the ADHD brain finds it so much harder than neurotypical brains to set up and keep healthy routines for diet, exercise, sleep, and workload in school or at work. Also, it's much more difficult to regulate your emotions and get you much more easy get addicted to nicotine, alcohol, drugs, and gambling, or have problems with gaming, shopping, or social media. And as we grow up and as our children gets more and more independent, we also are expected to manage and structure our lives independently, to pay our bills, to remember to take our medication, or to meet appointments and deadlines without our parents or partners having to remind us all the time. And these 7 life areas stand out in our research and also in other research as carrier of so much of the comorbidity load and the decreased quality of life load for both males and females. And the problem here, unfortunately, having ADHD, you will live in a world designed for the 95% of the neurotypical people, and you risk getting a lot of well-meaning but quite useless or even actually harmful advice for how you should manage life and why life it keeps being so difficult for you. So my favorite bad advice then would be, since I have a background in addiction medicine, would probably be, oh, you seem so tense and stressed out, you know, live a little, have a drink and relax. Or why not, on the topic of the emotional lives of girls with ADHD, if you feel angry, you need to stand up for yourself and say that. That's really, really bad advice when so much of the emotional lives of girls revolves around social struggles and rejection sensitivity. So we need to focus on better advice to try to build our emotional intelligence. And so how can we help then girls and young women with ADHD to develop their emotional intelligence? In our research, based on this patient and public involvement and our co-creative development of the digital support tool for women, Letter Life, we have identified some key areas for female ADHD. So first of all, many ADHD girls and their parents feel abandoned by healthcare. And they feel left with at best, an incomplete toolbox. Many women also specifically say that their ADHD problems stems from difficulties in regulating emotions and energy levels. And many feel that they somehow have to choose between strategies based on medication and healthcare or self-care, self-help, or skills training, or that medication for some reason doesn't work properly, or that both side effects and effects are inconsistent and hard to understand, perhaps due to hormonal fluctuations. And to build the emotional intelligence and resilience, we focus on some key ingredients that are adapted from CBT, DBT, motivational interviewing, and mindfulness. Because if you have masked or mimicked in order to feel normal your entire life, your self-awareness is probably quite underdeveloped. And you may feel very overwhelmed by questions like, what do you feel? Or what do you want me to do? Or what do you need? So when monitoring, instead of focusing on how you feel, focusing on how you are doing, you might start by monitoring how you do on the different lifestyle factors that we talked about in our 24/7 model, for example. That might be a good start for understanding your emotions and what triggers them. It can be everything from hormones to rebound effects of medication or a bad night's sleep, right? And then when you keep track of what works and what you have to struggle with, you can also send messages to your future self before upcoming PMS days, instead of having others like parents pointing out to you when you are misbehaving or when you're probably having a bad day. And this might be especially then empowering for teenagers. And collecting also your own real-life information about yourself will also armor you with objective and personal data, allowing your healthcare professionals a better basis for their medical decision-making. And as we said, there are almost no research on this topic. So we have to provide the information for the healthcare professionals. We have to provide the information on how hormones, for example, influence how we feel and how we are doing. And our emotional intelligence is built in interaction with others that we feel safe with and respected by. So that is why techniques from motivational interviewing, for example, like active and non-judging listening and reflecting is really crucial. So instead of coming up with suggestions and solutions, try to just reflect back what your child is telling you. To be heard and to be listened to is really empowering, and it builds emotional self-efficacy. So finally, we have identified some key concepts where the common language of the ADHD 24/7 model may help us to come through to other important adults in our children's lives. So you want to make sure that your daughter's school, for example, has sufficient understanding of her unique challenges. And by explaining her difficulties using the metaphors that we use in the 24/7 model may help the teachers and school staff to see beyond this compliant and silent little girl that keeps it together in the class just to explode when she comes home, or does really well in school but is so drained of energy that she just has to go straight home after school and miss out on all the important social life that the other girls share. So use our metaphors here or invent your own. But the important thing is to start to quite early in life talk to your child about how emotions and lifestyle factors are tied together. So don't forget to talk about how in period of hormonal changes, for example, or other stressors, we have to be extra careful with our body balance and make sure to eat healthy, to have a good sleep routine, and to exercise regularly to build our emotional resilience. And also that it's not cheating, but really, really smart to start building a really diverse toolbox to handle your emotion in different parts of your life. And reaction sensitivity dysphoria, or RSD, is characterized by extremely painful emotional responses to real or imagined criticism or rejection from others. And it's really common in ADHD, and it can become a self-fulfilling prophecy. So I would just like to tell you a little story, or a little result from a research study, actually, who shows the power of teaching girls with emotional dysregulation to give them time to not react on instinct, but to try to reappraise what they are seeing and what they are experiencing in different situations. Because if someone shows you a picture of a woman crying and asks you to guess what she's feeling, you'll probably say that she looks sad, right? But if you don't hear that she just met her son who's been traveling in Asia for a year, you might perceive her reaction quite differently, right? So this reinterpretation influences our emotional brain processes, something that we actually make use of when we develop our emotional intelligence. A key to better emotional intelligence is to recognize when your brain is more easily triggered, perhaps using or during PMS, and to work actively to reappraise your perception and emotion and refrain from acting until you feel emotionally anchored. And finally, how do we build emotional resilience in our children? Well, first of all, we want to make sure to optimize the things that we can actually influence. Some research suggests that stimulant medication may improve emotional dysregulation, while others show less promising effect. The things that we don't know, and we have anecdotal evidence pointing to differences in medication effect across the menstrual cycle. And since dopamine and estrogen may moderate each other's effect, this is a valid hypothesis, and that could lead to both over and under stimulation of the medication, depending on the hormonal status that we talked about earlier. And also, if your child suffers from distinct comorbidity, she may need treatment for that also, because it's not certain that ADHD treatment will take care of symptoms of anxiety, depression, or bipolar disorder. Second of all, we have mindfulness. So part of building emotional resilience is finding ways to stop the emotional impulsivity and buy yourself time to reflect and choose a way to react where you can, something that you can live with, even though the emotion will pass. So even though there is not much evidence for the effectiveness of mindfulness-based practices in ADHD in younger children, it's often used in DBT treatment for older adolescents with emotional dysregulation. And again, it's almost never either or. You don't have to choose medication or to meditate your way out of ADHD, but rather try to introduce this aspect of reflecting on your body balance and recognizing your emotions, and talk to your child about that. And then finally, moderation. So if you and your daughter are anything like the many girls with ADHD and women that I know, moderation is probably not your middle name. But then my experience, however, is that even very young children can visualize the volume button in the ADHD 24/7 model, and working towards moderation in all aspects will build actually emotional resilience. So try to be creative. Maybe you can do a chicken race of how long you can go without entering the volume button's danger zone, how long you can stand doing things in the activity level between 40 and 60, or how you can take yourself out of the danger zones. And really, really important also when we talk about the emotional lives of girls and women is to understand that they have probably, if they are or misdiagnosed, build up a life with perfectionism, stigma, and shame around themselves and their behavior. So to identify the downstream psychological consequences of living with undiagnosed or untreated ADHD is really important. Many of these girls and women, young women, they have developed a harsh and negative choir of voices playing on auto repeat day and night, voices of self-doubt, not doing things good enough, letting yourself or others down, or being a failure or an imposter. So this is why we have to work empowering and compassionate and try to exchange the vicious choir by a compassionate choir and self-awareness. And knowledge that emotions are made from perceptions, interoceptions, and previous experience is key here. And knowing that as long as you don't act on your emotions, they can't hurt you. Again, self-discipline might sound counterintuitive when it comes to fighting perfectionism, but the truth is that setting empathic boundaries for yourself and for others, for example, asking for a timeout in a heated discussion before it turns into a conflict, you buy yourself time and you show yourself and others that you can stay in control. And you take responsibility for the situation, and you stay accountable by circling back then afterwards when the temperature is cooled off. And then self-compassion, a necessary component to heal and to move away from degrading self-image and to build healthier relationships to yourself and to other. Maybe enjoy a gratitude practice every evening or when you drive your kid to work. So before we round up, do we have the information now to answer Annie and her parents' questions? Do you remember the questions? First of all, Annie asked us if her brain was wired differently. And I think we could say yes, but also that all brains are different. So we will ask her to be curious about her own ADHD profile. Then they asked us, her parents, how it all would tie together. And we could say that, yes, emotional dysregulation is the core feature of ADHD, especially in females. And hormones affect brain processes that is crucial to regulate behaviors. They also asked us what we risk when clinicians don't understand that girls present differently. And we can say that this is a great question because early detection and adequate support is crucial to prevent multimorbidity, polypharmacy, and extensive healthcare utilization associated with female ADHD. And finally, they wanted to have tips and tools to navigate. And we say that, yes, there are a lot of tools out there, but it's really important that you are aware of your own ADHD profile and that communicate your own needs to others. And that you arm yourself with your own objective real-life data for safe shared decision-making with your healthcare professionals, for example. And then I would just like to say, again, thank you so much for the opportunity to talk to you today. And looking back at the time that has passed since I first became interested in the emotional lives of girls and women, I feel very fortunate that the literature and the interest is growing and that me and my research group is standing on the shoulders of some true heroes in our eyes. So we hope to be part of the movement forward and to be able to be part also of the increased knowledge and support for females with ADHD. And if you want to read more about girls and women, there's a discount offer from my publisher, Jessica Kingsley Publishing. And if you're curious about Letter Life, our co-created digital tool for females, you're very welcome to visit, and we will allow you direct access to the app for free. And please follow me and others advocating and raising awareness for female ADHD on social media. I'm on Instagram, Facebook, and LinkedIn, and almost on TikTok now. Not according to my kids, but I feel very confident that I will be on TikTok in just a while. And this quote, to round up, from the French philosopher and author Albert Camus, I think it sums up so very much of what girls and women with ADHD tell us about their lives. So thank you so much for listening, and hopefully I will be able to take some questions now.
Yes. Oh, Dr. Skoglund, that was an incredible masterclass in ADHD in women. And I want to congratulate everyone who's listening, because I think at this point, our audience probably knows more about ADHD in women than many of the medical professionals who they see. I say that a little bit flippantly, but it's actually true.
Unfortunately, that is true. I wish that it was not the case, but again, we have to educate ourselves, and we have to lead the way, I think.
Yes. So thank you for helping us do that. I'm going to do a quick recap on the poll question that we asked at the outset of the presentation today. We asked about those, the percentage that had been evaluated, and that was 74% had been evaluated and diagnosed, their children, and 21% had not. Now, among those children who had been diagnosed with ADHD, I'll point out that only 42% were screened for comorbid disorders like anxiety and depression. I probably don't even need to ask this question, but Dr. Skoglund, should that number not be 100%?
Oh, definitely. It needs to be 100%. Otherwise, you haven't really done your work properly. I guess I will get a lot of angry colleagues when I say this, but the comorbidity is the rule rather than the exception. And sometimes you get the misperception that ADHD in females is a light version of ADHD in male, and nothing could be further from the truth, actually. And our data and others research groups focusing actually on females show that. So we have to be prepared that when you have a girl or a woman with ADHD, you should be prepared for anxiety, depression, eating disorders, self-harm, even more serious than actually for the boys.
Right. And someone wrote in just now to say, is it standard for children to get tested for all of those in an ADHD diagnosis? I think it's really imperative for caregivers to insist.
Yeah, I think it is. And it looks very differently in different countries. And even in a small country like Sweden, it looks very differently in different settings. So we have to advocate for this as parents and as patients to make sure that we get the full picture, because we need the full picture. That's why the ADHD 24/7 model, we need this full picture to move forward. Otherwise, we risk actually and driving off course and doing things, wasting time and resources. That is very serious, both for us and for the healthcare system, actually.
Absolutely. And you mentioned this several times in your presentation, but I think it's worth repeating that girls in particular are prone to masking their symptoms. And sometimes that may look like perfectionism. It may look like procrastination, even a lack of motivation, but it really is critical for the clinician to understand that the signs and symptoms will look different in girls and of ADHD, but also, those comorbid, like anxiety in particular, I'm thinking.
Yeah. And we have to be curious and clever when we ask about this. because having masked and having mimicked and having done this your entire life, or your entire life from being a girl to a young woman, it's not certain that you have the words or that you have the expressions to actually explain what you are going through and what you are suffering from. So we have to be very receptive and actually also look on the full picture of how this girl is doing. And overwhelmed would be one of kind of the core words, like the slogan, I would say, for overwhelmed and overflooded. That will be so many of the girls that I see talk about that in different words and on different themes.
Mm-hmm. And I have to say, this dovetails with something I heard. I mentioned that the ADDitude team attended a conference for ADHD this last weekend, and one of the leaders in the field, Dr. Anthony Rothstein, said, he questioned, why is it that ADHD is diagnosed on the basis of impairment, but other conditions are diagnosed on the basis of suffering or distress? And to me, this was like such a light bulb moment that wouldn't we all say that our, this emotional distress that we're describing here is indeed impairing, right?
That's good. Yeah, it's a good point. And I think we should be both. I think we need to look at both the impairment, because it's a lifelong for many individuals, and then the suffering, of course. And then again, when you get the adequate support, it doesn't need to be an impairment for all people also, right? So right. That's it's a really interesting diagnosis that we are fortunately interested in, I think.
Yes. And to that point, you mentioned, a lot of the risks associated with ADHD, specifically in girls, and several people asking whether there's research suggesting that medication use for ADHD does help to reduce those risks. So things like the sexual promiscuity, car accidents, you name it.
Yeah, there is a lot of research actually showing that medication can be helpful to reduce a lot of the adverse outcomes associated with ADHD. Again, what we have to remember is that maybe we have samples that include enough women. But what I'm almost 100% certain of is that we do not know if these women are, or what part of their menstrual cycle they are, or if they're also taking oral contraceptives. So we don't know about their hormonal status, for example, when we look at the outcomes. So again, the research is flawed in that sense, even though it's getting better because we also have female samples now. So we have a sample that is actually perhaps even 50-50 females. But then we forget that sometimes we forget why we actually add females into the research studies. And that is because we are like two different subtypes of the same species. And we have to consider the hormonal aspects, I think, specifically when we consider ADHD, because hormones have a lot of cognitive effects.
Absolutely. Such an important reminder. We received a lot of questions today about whether, again, there's research on the impact of contraception, birth control in adolescent girls with ADHD. And, we know that the comorbidity with PMDD is so high. Is there any research one way or the other?
Yeah. So we did one study where we showed that women with ADHD are 5 times more likely to develop depression following hormonal oral contraceptives. However, what we saw that there was no difference between progesterone pills only or combined pills. So we don't think that it is the absolute level of hormones that is important, but rather that females with ADHD, due to their ADHD, might forget to take their pills or take them more irregularly. So there will be fluctuations again. So, and that is something that we see and that we are going to follow up in future studies, that we think that it's not the hormones per se or the actual hormonal levels, but when hormones change, that is especially bad for neurodiverse women and girls. So and that's also what we see during the lifespan, right? That in periods where hormones are fluctuating or changing, in puberty, after birth, postpartum, and in perimenopause, across almost 10 years across perimenopause, when hormones again. I usually say, once you finally start understanding your hormones, then they start changing again. So it's a huge part of life where our hormones are actually unpredictable to us.
Mm-hmm. And I know we're out of time, but I have to throw in one last question because it's just so pertinent here, and that is, we've been hearing a lot at ADDitude about very new thinking regarding the ADHD medication use and how it may be adjusted to accommodate sort of the hormonal monthly cycle. Yeah. Is there any research that you know of that's going on? And do you see this as something that we will probably see more of in the coming years, the recognition that your dosage may need to change?
Definitely. So there's a very limited research. There's only, to my knowledge, one observational study just published by Sandra Coy and her research group. However, this is something that we see in our clinic all the time. That is that I usually work a lot with cyclic dosing. So that is definitely something that we will see more, but also definitely something that we need to research more thoroughly. So our research group are doing a lot of studies on this. Hopefully, you will see them published in a year or so, because research takes time. But while waiting for research, you should ask your clinician, what do you know about this? Can we educate ourselves together? Can we see how this is playing out for me in my hormonal life? So don't wait for us researchers, but hope for us, because we will come with the evidence in a while, but it takes some time. So just start educating yourself and make sure that you know how hormones affect you.
Dr. Skoglund, I cannot tell you how much we appreciate this session. It really was just mind-blowing. I really appreciate your contributions, not only to the ADDitude community, but to this whole field of, understanding and being able to help better women with ADHD. So thank you from the ADDitude team.
Thank you for having me. It's a huge honor. Thank you.
And thank you to everyone who attended here today. Please know that you will receive a replay link for this video, as well as a copy of the slides. And we encourage you to share both of them with your treatment team. And we hope that you will join us as well for another ADDitude webinar in the future. Our next one is on living with ADHD in your 20s. So please join us again. Sign up at additudemag.com/newsletter so you don't miss a thing. And we will see you again soon.